been a while, but now we're back. It's been 2 weeks since I had labrum surgery, and I had a lot of worries going into it. It's cautious. You never really know with surgery what's going to happen. Always works, especially with something like a labrum or an ACL or an Achilles, where you never know if you're going to get back to normal after the surgery, like you were before you got injured, right? So it's been 2 weeks, and I actually feel great. We went in when the doctor went in. It was a lot better than he expected. I don't know if it was from the 4 months that we had off that I didn't do anything with my shoulder that actually let it heal up slightly, or the MRI was just off. Dr. Ann seems to think, MRIs don't always show what they're supposed to show. He put it as like, looking at a black and white TV and trying to pick out somebody's colored shoes compared to, watching an HD 8K video of something, right? So he doesn't really know what happened. He just knows that the labrum was not torn posterior and posterior and superior, which is great because it looked terrible on the MRI. And like I said, there's probably was tore a little bit because he did say there was a crack in the in the labrum when he went in there. But really, all he did was he went in, cleaned up a bunch of crap that was in the joint, and didn't have to suture anything. We were thinking anywhere from 4 to 6 sutures. No sutures were put in at all, which is great and a fantastic news to me. And so I can get back to training a lot sooner than we thought before. But the biggest thing with me just getting back into things, is I could move my arm like the day or two after surgery. I had a pain pump in, so like basically it was shooting some sort of medicine to numb me through the nerve block through my neck. So like during surgery, you get a nerve block so you don't feel pain during the surgery or when you wake up. But with the pain pump, they run the catheter where that nerve block was, with medicine, with numbing agents. So for the next 5 days, whenever I felt a little pain, I could press it and I could have a big shot of nerve numbing medicine, or it was just a slow release throughout the 5 days I had it on. And I could move my arm pretty decently, a little bit of flexion, a little bit of abduction. But once I took it off and all the numbingness went away, the pain subsided a bunch. I mean, there was some pain there, but I could really move it around. And I'm 2 weeks out and like go overhead. I mean, rehabs are going great. I started training again this week. So that was a big positive to me that I could train again. But just being excited to know that my shoulder wasn't as bad off as they said, as we thought originally. So hopefully I can get back training sooner. He said really no snatching or anything dynamic for 10 weeks. But knowing me, I'm going to push it, and me and my PT, we're going to push it. I mean, he said benching in 6 weeks. The goal is to bench for the first time March 1st, that Monday, whatever that Monday is in March. And I'll probably go through 15 because anything in a prone position lying down feels great. Overhead still feels awkward and a little painful just from surgery. But besides that, I'm good to go. All right, let's get this screen recording. All right, so what we're going to do now is I actually have the videos from my surgery, and we're gonna go over all of it and see exactly what he saw, and we're gonna look at all the pictures and everything. So I mean, here are all the pictures. You can see he went through the labrum. This is kind of the stuff he cleaned out a lot of, all this gunk that looks like cotton candy. You can really see it in here. He cleaned out all that junk that just was gristly and nasty. But let's look at this first video and see what he has to say.
Smooth, nicely attached. You just got into your shoulder. We're looking from the back towards the front. And this is your front labrum. You see how it's nice and smooth, nicely attached to your glenoid. And the ligament is appropriately tensioned and nicely attached. So the front of your shoulder looks nice. As we look up towards the top of your labrum, this structure looks normal as well. The expected disease is going to be more back here to the back, more in this area. That's what we're really interested in. But so far, the front and the top look normal. This is a sublabral foramen, and you can see your labrum is confluent with your middle glenohumeral ligament. So we're going to make another portal and look towards the back next. Spinal. You just got into your.
All right, so that was the first video. Now let's go check out this second video.
Superior labrum looks normal.
So that right there is what he used to scrape out everything.
Biceps tendon looks normal. Rotator cuff looks normal. Some minimal fraying. We're just gonna gussy a little bit, but nothing to get excited about up here. See that arthocare? Some minor smoothing,
or just kind of
nothing to be concerned
stuff that
about
they
there.
need to clean up.
Now we're going to go from the front.
This wasn't too bad. This was the front. So the front and superior is actually really good, relatively speaking.
We're looking from the front to the back. You've got just a small crack right here, but it looks like it's partial. We're going to feel of it from a different angle and see. This is where you had the cysts on the MRI or adjacent to this one area.
That's where it was really bothering me when I was training. I believe were those cysts that had built up where that crack was, or that might have been where it was torn bad and it slowly healed over the 4 or 5 months that I did absolutely nothing with this arm. I'm going into surgery.
This area looks pretty normal too. So this is some age-related change of this, but I'm not seeing a full thickness tear in it. I'm seeing some partial thickness tears that looks like we can smooth and contour.
So that's really good. I mean, if you're seeing partial tears that look like they're going to heal themselves, that's great. That means they must have healed themselves slowly over time. But here he's really going to start trimming stuff down. As you can see, stuff flying off the labrum, all this little hairs. He's going to suck all that out. Yeah, this is what was bothering me. This is
probably more your culprit right here. This is where you've got just a little bit of some disruption of the ligament off the humeral head. This is probably more the injury right here.
like all of that is not supposed to be there. That's supposed to be smooth.
Just got some very partial avulsion of this ligament, but it's very minimal. This compared to your labrum, the labrum looks pretty good. You know, it had just those small little cracks in it, but nothing major to it that we've smoothed. I'm going to investigate this area of the ligament right here. Yeah, that looks to be your injury right there.
All that tissue right there from the ligament that kind of wore off and scraped off over time.
So you have more of a partial undersurface, very small infraspinatus rotator cuff tear, and we've debrided that. And our experience in throwers is that these do fine with just debriding the frayed portion. We are going to drill some holes in it to make it bleed, so it'll have a healing response.
So with the holes, I think that is really what's bothering me still. The pain from, drilling in the bone, getting that bone marrow and blood out. That's what's bothering me the most still, I believe, with the surgery. The holes are fine. I mean, those are how he got into me. That feels fine, but I really think it's just the bone healing. As you can see,
this will stimulate a healing response from your bone marrow.
Let's watch that again. So as you can see, this is where he's drilling into my bone to get the bone marrow blood to flow out to hopefully help it heal, because there's not a lot of blood flow with ligaments and tendons. So if we can get a little blood flow in there to slowly help that scar tissue, hopefully it'll start healing itself like we want to. As you can see, there's the blood coming out from drilling the hole. You just see the blood just circulating through the joint. Right here. There it is. Now it's starting to come out.
Drilling will allow some bone marrow access to this site to help you heal it. You can see the bone marrow start to come up from your drill holes.
All right, that's all the videos. It was pretty good. I mean, relatively speaking. I mean, from what it looked like to what we thought everything was going to be. I mean, I really came out on top of this surgery. So I would recommend to anyone, if shoulders bothering you, knees bothering you, your joints are bothering you, don't be like me and wait 2 years to get an MRI. Go get an MRI. I mean, and then go talk to a professional. Go talk to a couple different surgeons. I talked to 2 different surgeons, and they said different things. Both needed surgery, of course, but one was from Dr. Anson Andrews Institute, which is the top of the field when it comes to surgery for athletes, and not just athletes, but everybody in the world. I mean, there's always pro athletes walking in there. You walk into their office, and there's hundreds of signed jerseys and pictures from football, NFL, professional wrestlers. I mean, these are the top of the top with these guys, who they work on. So I wanted to go with him because the other doctor in our area was telling me, 6 months, release you, be patient, blah, blah, blah. And, that's fine. I get that. He's doing what he needs to do, but he doesn't realize the type of athlete I am and what I need to do to compete again. I need to get back to 2020, July 2020. I barely missed a 205 clean jerk, and I clean 207. That, and then my shoulder really started bothering me that August, right? But I think I had issues stemming all the way from that prior, either spring or winter. I was having issues. So don't wait. Go talk to a doctor. Go talk to a physician, a nurse practitioner, somebody who you can talk to. Because I got plenty of shots and they didn't work at all. They might have helped for a little bit, but the pain never really truly subsided. So hopefully this is going to take care of the issue that I have right now, but only time will tell. Stay tuned with the rehab and my training. I had my first week of training was this week. I took the other 2 weeks off. I did a little bit of biking here and there at one of the Globo gyms in town. But I'm going to do about a 6-week triphasic cycle with just belt squatting. I'm not really going to load myself up too heavy. Dr. Ans did say I could, get in front rack positions or put a bar on my back. But if I do anything like that, I'm probably just going to use a safety bar, maybe even a cambered bar or the Mars bar for now, because I really want to get my mobility back. Because when the bar was on my back or even a front rack, that's when it was most painful. So I want to make sure I get the mobility back to know, all right, I'm in this position. Did the surgery actually work or didn't it work? So that'll be, a few weeks away to tell. But like I said, hopefully by the end of the month, I'll be benching again. Won't be doing anything overhead. Won't really be snatching. I'll be doing some barbell work. I would like to be doing barbell work by the end of the month. But remember, stay tuned. Like, subscribe, share, comment, do all that stuff. It just helps the algorithm, all this stuff get out. Like I'm going to start posting more now that I'm out of surgery and I can actually do things again and move my arm, because it was so hard to try to video and stuff in a sling and move cameras and all that good stuff. So, appreciate the video. See you guys next time. Watch me shatter!